surprised why he never came early to the clinic, or he never felt the pain before, or no one told him to go. I had no idea, but that condition wasn't good. But I have to clean this thing before the doctor comes to make sure that his finger is okay. At the same time, I have to take the blood. Why I have to do the cleaning part? Because the doctor told me this is like sometimes you have to do this, but I don't think anyone would have said that. I did that because he was screaming, jumping with pain. So I have to gently clean, and she told me how to do that as a learning procedure. So I did that. Until that time, he was loading with words that is not appropriate because of the pain. But I was calm. Why? I've been told to. That's the professionalism. And you are representing the lab. This is another thing. Now, when you go to the placement, you'll be representing the college. Have patience. Treat all patients with respect and kindness according to the CSMLS, according to the MLPAV guidelines. It could be that person who's there can be someone's father, the lady if is coming, someone's mother, brother, sister, grandparent, whatever it is. You have to treat them as a human being with kind words, with respect. Some of them, they forget, short-term memory loss. You might be telling them to sit there, and then you're going to get something, and then that patient would be going outside. Especially in hospitals, you will come across different situations. Go them, talk to them gently, and then bring them back. Don't go and tell them, I told you to sit here. Why are you going outside? Can you say this in a loud voice? No. If the others hear that, we have to go home because no respect. We know that's not good, but they are not in their own condition, in their own senses, because of illness, because of different painful situations. So as a professional, you have to handle them. You have to take care. Take the time to properly identify the patient. About all these things, when you are stressed, don't make mistakes in the identification of the patient. That's another mistake, big mistake. And think about their needs. If someone is not good in English, they may have difficulty understanding. At this situation, ask someone to come and interpret. Okay, in hospitals, they have it. But in the clinics, there will be someone who will be talking their language, so bring them. Adjust your collection procedure to accommodate these needs. So if someone cannot keep the hand, they need 2 pillows, give them 2 pillows. Okay? If they are telling you, can you please wait for a couple of minutes, wait for a couple of minutes, but don't wait for half an hour. That's baseless because there'll be a big lineup. You have to collect more patients. Assign the duty to someone else who is an experienced person. Tell them like he needs some time. So can you please take care of this? Or tell the patient to sit outside for a while and then bring the other patient because we don't have time, but in a polite way. Get assistance if required. I would recommend always get assistance because there'll be a witness. Sometimes when they blame us, there'll be another witness to help us. It could be a nurse, a family member, or another phlebotomist. I would go for a nurse. People who belong to the same profession or different profession in the same field, I would advise to bring them. And patient identification, be very careful. Correctly identify the patient, and if there are certain things written in the requisition, mainly if it's for diabetic patients, ask them fasting. And also the patient who are checking for the cholesterol, for the lipids, they also fast. Or if there is some other condition where they have to fast, check for the fasting. Ask them. If patient cannot identify themselves, verify patient information with a relative. Now, my question is, when do you think a patient cannot identify themselves?
When they are unconscious?
Okay, very good. Unconscious. In that situation, definitely a nurse will be there. Other situations where they cannot identify themselves.
When they are in serious pain.
Or the elderly person.
One at a time.
When they are in serious pain, they won't be able to concentrate on
Serious pain could be the reason. Okay, then Alzheimer. Have you heard about the Alzheimer's?
Yes.
They forget.
Yes.
So in that case, don't ask the patient, what is your name? Even if you ask them 100 times, they're not going to tell. So there'll be some other person bringing them. Ask them. Right? Or a caretaker. This is the situation. Or who has some cognitive challenges. They're not actually some kind of disorder in the brain. Those patients, they cannot identify sometimes. So these are the situations where you have to ask other person. And you document it. The beautiful thing, the patient or this patient came with the caretaker, caregiver, or relative. Document. And this time, this date, and you did the venipuncture. That's what it is. Okay? If a third party identifies the patient, you are required to document this on the patient requisition or label. Not only documenting in a paper, that you have to document this in a label also. If the label is there, if the patient is not able to identify himself or herself, if the caretaker or some caregiver is telling that this is the patient, document with initial. This is very, 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 very important. Now, pediatric patients, coming to the first situation, pediatrics. What does pediatric means? What do you understand by pediatrics? Sorry, guys. What do you understand by pediatrics? Children. So how will you do that? The best possibility is, depending on the age, you may have to ask the parent about the child's past experiences. Now, at this situation, was it okay? Have you done this to this child before? Okay. Don't ask the child, for example, a 4-year-old. Have you done this before? Sometimes they remember, sometimes they don't. If a 12-year-old is coming, can you ask the 12-year-old or the mother or a father?
Parents.
Parents, even for 12-year-old?
Yes, because she's also underage too, so you can have.
Yes, and but the best thing is, as they are growing little bit older and older, they become independent thinkers, so you can ask them directly. If they are like below 5 or 6, they don't know what they are talking. Sometimes they will be excited as you will come across that things. So if they are growing a little bit older and older, you can ask them. Of course, you can talk to the parents, but you can directly ask them, have you done this before? They will say yes, something like that. But if it is little, some children are very, very shrewd. They will tell everything, the whole history right away. But still, we cannot take that as a guaranteed statement. So always approach the parents or the caregivers. Ask older children directly. So look at this statement. Older children, directly you can ask. Okay, and also to the parent. Give the parent the option of staying with the child or waiting outside. What do you want me to do, honey? Can the parents stay here or they can wait outside? It's for 12 years. If it's little, better tell the parents to stay. But this will be like for you, this is working under pressure. Encourage their involvement as it reduces the child's anxiety. Why we tell the parents of the little children to stay there? Because they may be anxious about the needle. Not everyone is brave enough to handle that. So when they are there, they talk to them, they will convince them, or they can extend their arm, or they can sit on the chair and they can make the child sit on their lap and they can help in extending the arm. So when there is a situation where they move their hand or something, they won't injure themselves. So the parents is a better option for you to do the phlebotomy. Okay? And they will also feel calm and confidence because we will be strangers to them. Mainly, this will lead to anxiety. Usually, the poke leads to anxiety even for adults. So, for children, obviously, it may lead to anxiety. So staying with the parents make them feel better. It's best with older children to gain their trust. Children have longer comfort zones, so they won't be so comfortable when it comes to a new technician. Some known person, better parents should be there with them. And approach slowly and show a positive body language. Be open to them. If they ask you question, answer them politely. Give them some job. Can you hold this? Or just take it in a playful way, like give them the tourniquet. Can you stretch? This is elastic. Can you stretch this? They will start playing and then they'll feel comfortable, and then they may ask, what are you going to do with this? So this is just to make sure that the blood will be flowing properly, and something like a positive words with a positive body language is important. The parent or another collector may have to assist in holding the pediatric patients to ensure they remain still. This may increase the anxiety, but that's okay because someone is there to stop the mobility. When in case if the needle is inside, if they are moving their hands, it's a big no, no, no. This may cause internal injury in the hand, and that can lead to infection. And once again, there'll be a big complaint. And who did the job? This person XYZ did the job, so they never did the proper job. We don't want all those tensions. There are also numbing options. So in some situations where the children are really small, like for example, 3-year-old, before seeing the needle, when you explain this, there's going to be a poke, they'll start screaming. So in that situation, to avoid, so tell them, talk to them. So I'm going to apply some cream. It'll be okay for you and everything. There's a topical cream that causes numbness in that particular area prior to the collection, and then your job will be easy. It's all up to the situation. You don't see a child and decide, okay, I'm going to apply cream. No, it's up to the situation. Assess anxiety levels first, how comfortable they are. Okay, are they biting the nails? Are they going to cry? Or is there anything that you can see their face, and by their reaction, you can assess, okay, what I'm going to do next. For that, you have to be more confident in your job. That's the first thing. You shouldn't be distracted, and you have to handle in a very calm way as a professional. Determine degree of anxiety before handling equipment or touching them. So you have to assess first, and then you make the decision. Okay. Reduce intimidation by getting down to their level. Talk in a way that makes them feel comfortable. What color is this? Oh, this is green. Oh, wow, good. So something like that to make them feel good, to make them, okay, this person is good. A feeling of belongingness should be there because you will be in the close space with the child. Explain to them what you're going to do in terms they can understand. So this is another thing. If the child is asking, will it hurt? No, not at all. Is it a right thing?
No.
Definitely a big no. Don't tell them that. It's going to hurt, definitely. There'll be a pinch, something, but they'll be okay. You'll be fine. So all these things are better. Okay. How to best handle pediatric patients? Never lie, first thing. Answer questions honestly. Never tell a child that it won't hurt. A big no-no. Say it may hurt just a little bit, but it'll be over quickly. Share control. Give the child a job to do, like holding the cotton or the band-aid or the gauze, because they'll be distracted. They'll be in their own world, so your job will be easy. How to best handle pediatric patients? Distract them. Use age-appropriate distractions, counting, if they like something, coloring, like ask about the colors, singing, games, movies, rhymes, any videos that they like, hobbies that they do, all these things. Validate the feelings. Offer a reward for being brave, like stickers, appreciable words, good job. okay? But without conditions. Don't tell them, if you sit properly, I'll give you a candy. If you don't cry, I'll give you something else. No, all those things, no, no, no. Let the child know it's all right to cry. Okay, if there is a poke, if it's painful, let them cry. Right? Children are there to cry. Yes or no? I have seen some adults crying for nothing. I'm not kidding. They'll cry for nothing. Sometimes I don't even know why they're crying. They will cry. But this condition is better. At least it's a child. Let them cry. Okay? How to best handle pediatric patients? Stay calm. The same formula. Calm a crying child as soon as possible. Okay, because why? If they cry, it means the stress hormone will be there in the system and the hormone levels will be up and down. The metabolism will be a little bit up and down. And the blood collected at this time will show results up and down. We don't want these mistakes. Okay? Mainly the WBCs, the white blood cells will increase if a child is kicking the hand, crying. In that case, just let them calm down. But in emergency situations, you can ask Moon. She'll be lucky. I'm not working in hospital, but some children, they give so much pain for the technician, but they have to collect the blood. Doesn't matter the WBC go up or down. There are situations, exceptions. Help a child understand the need to hold still. So you have to tell them the importance of being still, without movement, without mobility. And the parent can play a very important role. They may take your work a little bit. They may share your work by talking to them, pacifying them. It's very important. If the parent adds to the child's anxiety levels, ask them to leave the room. Another job for us. Now ask yourself, or do we have to do this also? Yes, you have to do this also. We have no choice. If they are example of giving more anxiety, what could that be? I'm asking you. Anyone volunteer? What can be a condition that as a technician you have to tell them, can you please stay outside?
If they start
And they're
shouting, they start shouting.
Shouting, screaming, they are
Okay.
nervous than the child. If they are commanding you what to do, okay? So you know what? Can you please stay outside and call another teammate? I always insist, better than parents, other person, a phlebotomist, a nurse is good, because if the parent is there, still they will put the blame on you for nothing. So it should be a professional like you who can handle this. Yes, Santiago, question?
So, Miss, you mentioned calling a coworker to like come witness it. Would you call them before you ask the caretaker to step out of the room, or after? Because you mentioned
before. Before.
Okay.
The reason is the child shouldn't be left alone. Point number one.
Okay.
Everyone is busy. Keep this in mind. Everyone will be busy. Just tell them you need the situations like that. They will come. Someone will be there. They'll help you.
Okay.
Because sometimes it's true that some parents are really annoying. You will be busy collecting. You have to give the whole history, which tube you're collecting, why you're collecting, what you're doing, why are you tying, is it tied? Oh, my child may get hurt. The child is fine. But the parents will make all type of scenarios like this. It'll be irritating. Trust me. You'll feel irritated at one point, and then you know what? Okay, let us make some other decision. So better, this is the best decision to my understanding. So follow this. And iatrogenic anemia. What is that? We talked about it yesterday. Now you're going to talk.
So it's
Loss of
that is in
blood.
the hospital
Loss of blood.
Yes, very
whose
good.
blood
Yes.
has been drawn continuously.
Continuously because of the testing, diagnostic purposes. The doctors want to know immediately within like 8 hours, say, what's the situation? They may be giving one medication as a trial and then not exactly trial. They may assume something, okay, this is the situation. Based on that, they have to do something about it. So now they will be taking blood. I would say after every 2 hours, they are collecting the blood. Okay. So all these situations or any condition where more blood is drawn from a patient. Okay, for every 10 ml of blood, 4 milligrams of iron will be going with them. If you're taking 10 ml tube, 4 milligrams of iron is gone with the tube. So already if a person is anemic, if a child, for example, is anemic, and then we are drawing mainly if it comes to the cancerous condition for treatments, yes, it's a difficult situation. So especially when it's a child, more loss of blood will be there, more iron will be going outside. So you cannot just load iron inside the IV, the IV. It's not possible. Slowly the blood has to circulate, so it has to develop on its own. It's a healthy condition. Instead of just loading with iron from outside and you're taking the blood continuously for 2 or 3 days if a patient is there in the emergency. And every time you have to go collect the blood. After every 2 hours, you're collecting. So this lead to anemic condition, what we call the iatrogenic anemia. Keep this in mind, you'll get a question. There is a maximum whole blood volume that can be removed from a patient. Again, they have the CLSI guidelines. It says that this is the amount that has to be collected, but mostly concerns neonates. This is mostly with the neonates. You know, nowadays, I have seen like 20 years ago in a hospital setting where there are different complications after the childbirth. They'll be shifted to incubator, they'll be getting all the IV tubes, whatnot, and if it's like a different condition, so many conditions. And that patient's blood, the baby's blood has to be taken little bit to check something. It's not a good idea, but it happens. If you go to sick kids, you can see this. Okay? And also in some old patients, they have rolling veins, they have a stroke, they cannot move one part of the body, but the blood has to be collected to check their different conditions. It's not a joke. And neonatal wards may have a collection log to document the volume of blood drawn to avoid complications. And remember, for the old patients, they don't record the volume that they take. But for the neonates, the newborns, they are recording this or they are documenting this as a log because the child, the newborn, can go into cardiac arrest. It's called the cardiac shock when there is no enough blood to circulate in the body. Clear?
Clear, ma'am.
Any questions? Because we're going to old people. With the children, it's done. We're going to old people. Any questions? Yes, Varna?
Ma'am, sorry to interrupt. I have a doctor's appointment at 11 o'clock and I need to leave at 10:30.
10:30? So,
Yes,
okay,
ma'am.
5
But
more
I'm
minutes.
still online. I'm still
Okay.
online. Yes.
Okay,
Thank you.
you're most welcome. So what is this geriatric patients?
All people.
Old people, very good. So what are the difficulties of the old people? I have seen old people also. This old people, it's not easy. Again, collection with the 90 and above. It's really, really hard. Definitely, you should have another technician with you to just do the anchoring part of the vein. The vein will roll easily. You won't get anything. I call someone to just stretch the first time, just to anchor because of the rolling veins. This is how we get experience. Then we will have some knack to do the capillary puncture and all those things. But when the doctor says, try to collect it from the veins, you have to collect. You can't go and stand there, observe the patient and decide that, no, you know what, I'm not doing this job. It's so hard. I'm going to seek another job. People have made decisions like that also. But be confident, you can do this. But little bit of help, little bit of skill, training, definitely you can do that. And this geriatric patients, they feel comfortable working. If you're working with this old people, you will understand what they like, what they don't like, how they feel, which position is coming. You have to make them feel comfortable. With the babies, they just cry. But with these people, they can call the whole hospital ward if they are not comfortable. They will scream like anything, right? There may be physical barriers when it comes to the venipuncture, psychological barriers, social barriers, all these things will be there for the old people than the neonates or children. Okay, sometimes they don't even cooperate. They're very stubborn, worse than children. So you have to talk to them. If you cannot make them feel comfortable, better stay away, ask another patient to do the job. Mainly ask another team member to be there. My sincere advice. So elderly patients are as unique as anyone else and deserve the same compassion, kindness, patience, respect. They expect more respect. They expect more patience. They expect more kindness. You'll be kind, you won't talk, but still they will scream at you. They will yell at you. Just let them go. That's fine. Why it's fine? Because we can't do anything to them. They may be in a different psychological condition. They may be undergoing some treatment where they have the pain in the body. Okay, that's what I'm telling. When you see these situations in the hospitals, patients coming to the lab, you will feel that we are blessed. And in this geriatric collection, speak clearly and slowly, right? You don't have to talk that much with the neonates, but with them, you have to talk. Okay, give plenty of time for the patient to respond, means sweet patience. As a technician, we have to have a very sweet patience. Repeat your statement or question more than once. So when you give them instructions, ask them, can you explain it to me what I said just now? Ask them. It's better, safe. If they have some hearing problem, what will you do?
You have to narrate the procedure.
Still, they don't get it.
Sign
Right.
language.
Right.
Sign
you-
language,
Right.
You write it down.
Write it down.
write it down. Good. Sign language, you mean to say now we as phlebotomists all have to go to get a diploma in sign language? What is this? We are here to do one job. You're telling us to do more jobs?
My God.
Actually, ma'am, you have to
You need to
speak
action.
slowly, but you have to demonstrate with your arm.
Demonstrate
you
with
show
your
them
arm.
the syringe, yeah, and you have to collect from here like that.
Yes. Okay. Still, they're not getting. What will you do? Don't do the other job of going and getting a diploma as a sign language specialist. Sorry, I don't have time. Tara, do you have any idea what you have to do? What you can do? Tara, is she not there? What will you do? What do you think you can do?
With a person who has a hard time hearing?
Yes.
Are they completely deaf or are they just hard?
No, they are not completely deaf. You're going to
Okay,
collect the blood,
so-
but they are not getting what you are talking.
Okay, so
What will
you
you do?
speak I would slow down
Mm-hmm.
and I would turn my volume up.
Mm-hmm.
As well as when I was talking, I would be pointing at my equipment and stuff, like
Mm-hmm.
doing my best to make it clear for them.
Mm-hmm. Okay, good. And
Yes.
you document it, right?
Yes.
You document it.
Okay.
And
Narrate the
the
procedure.
best thing is still you ask
Face the
them,
patient.
if they're still not cooperative, call another patient. I mean, not the patient. We don't want two patients in one room. No.
No.
Cause another person, a phlebotomist or your supervisor to be there and let
Okay.
them
So they're
explain.
also upset.
Yes. And this
Okay.
is a witness, actually.
Right.
Okay, witness. So then what they will explain, and if they get it, okay, they may be getting if two people talk, definitely. If not, if they think, okay, this is not the situation where we can explain it to him, leave it at that time and let another experienced person comes there. They will be going two as a two now. It's all up to the situation, guys. Then they will take the blood. Okay? We can be like
Yes.
a bionic woman. They're standing there and the person is not understand, especially old people. They can pull the hand if they get irritated. They are worse than the babies and the
Yeah.
infants.
I had
I
the
have seen
experience with that, ma'am.
stubborn patients. So talk to them, like make a calm atmosphere, tell them, just talk. Little bit talking will help them. Because psychologically, they're not there to have fun. They come with no choice. Because of the illness, because of the family situations, they may be thinking something, you will be explaining something, and on top of that, they will be having the hearing problem, not with the hearing aid. Hearing aid is better because they have some equipment inside, but these people can hear half goes away. So in this situation, document it and then call another person, there'll be a witness, so you won't be blamed. Clear?
Yes, clear.
Yes, thank you.
Always document. If you think it's okay, this patient is not cooperative, another person of your team. And physical changes, if there is something like the skin issues, mobility issues, diseases like arthritis, they cannot stretch their hand. Okay, these things are possible. And coagulation problems, diabetes, Parkinson's, for all these physical issues, it's going to be hard for the old people. Mental and emotional conditions, and this is horrible. Mental situations are really bad. You cannot expect any cooperation from them. A caregiver must be there, or person who's authorized to take care of them. If you have to see the letter or the document, a legal document that they are the caregivers, then you can touch them. And this is really challenging. And then hearing and vision. We are going to talk about this in the slides, but it's challenging, but this job is rewarding too. It's very rewarding. It's not a joke. We are not there just to collect the blood. We have to face all these situations. We learn a lot. You will learn this technique in a very beautiful way when you are working under pressure, when you are seeing different kinds of patients. You will learn a lot. And day by day, you will see the progress in you of becoming calm, confident. So you will see the changes. Okay. And now skin changes means what? Loss of collagen and fat results in the whole thing. The skin will be like a loose pouch, or there'll be wrinkles in the skin, or the skin may not be in stretchable thing. If you anchor, it will be very tough. So it's hard to poke in these situations. So this is the possibility in old people, which makes the venipuncture hard. Or if they are in the IV, or if the blood is not flowing properly because of lack of water in them, a challenging ones. Veins can be sclerosed, means hard vein. That's what I'm telling. Sometimes the veins will be there, you'll be poking, blood will not be flowing in old patients. That's why it's recommended for the capillary puncture. If there is a little chance of getting the blood, you can use also the butterfly. And usually I go with the butterfly if it's old. Butterfly, the best option. Okay, veins are more fragile. Yes. These veins collapse easily. It looked like a big one, but nothing comes from there. And have more tendency to collapse, more prone to bruising. So even when you poke using the regular needle, they'll be bruised. There's no point of doing that because you won't get the blood properly. Butterfly, there is a possibility. So when the tough situation is there, when the doctor wants to see something very important, the best option is you can go for the capillary puncture in the old patients. What does this vein collapsing means? It's given with beautiful example. So this is the one. Where am I? Physical changes, skin changes, and then vein collapsing. See? But when they get the hematoma, you can see for them the whole hand get bruised. For us, the middle part will be bruised. For them, in majority of the old people, for some reason, the whole hand will be bruised. Okay? So look at the picture. Smaller fragile veins can collapse due to the vacuum pressure exerted from the ETS. The suction pulls the sides of the vein together and blocks the blood. That's the main reason. The vacuum that's entering inside gives more pressure to collapse. So it's not good for them. That's why I suggest butterfly. How to avoid? Use a syringe to collect. Pull the plunger slowly because the pressure or the vacuum that's in the syringe is compatible enough to draw a little bit of blood from the vein, mainly in the elderly, and slowly by pulling the plunger down, you can collect enough blood. But it's a slow process, takes time. You should have more patience, not rushing, like going inside, taking out, no. The tourniquet may have to be left on during the collection to keep the vein distended. It means if you see the blood flows, we remove the tourniquet. For them, the tourniquet has to be there for a while, for 1 minute or a little bit more for this old patient, these type of old patients. That leads to hematoma because otherwise we won't get the blood. Clear? Now, diseases, disorders that affect the patient. What could be the diseases? Alzheimer's, dementia, most of them Alzheimer's. Cancerous patients, unable to communicate meaningfully. This is a situation where they don't know their identity. They come there, they sit, you ask them, they don't know what to say. The caregiver always should be there, documented. We check for the legal documentation. If they say, he is my father, ask them. Majority of the situation, they have an authorized letter from the legal letter from what do you call a notary public, a lawyer, something. This is something you have to see as a technician as well. If you have doubt, if you don't know, like if you're not sure, you can call the supervisor. They can talk to them. Communicate to a relative or caregiver. If angry or hostile, don't take it personally. Don't take if they scream. If they, sometimes the words very harsh. Hey, miss, what are you doing? This is how they talk. But that's okay. Don't take it personally. Arthritis, joints, therefore movement is affected. So they will be already in pain. They will be in pain. Coagulation issues, if patient on blood thinners, high risk of hematoma, and hold pressure until bleeding has stopped. So you cannot tell these type of patients to hold the cotton or something. They may cooperate and they may not cooperate. But here we have to do the job. Okay? And other conditions, diabetes in old people, they affect the circulations. So you have to make sure you keep a warm towel on top, and then to establish for a while, for 10 minutes, you keep a warm pack or a warm towel on the hand, so that can help you get the blood flow. Even it can be leg, foot, ankle collections, everything is limited. In these situations, we better go for the capillary puncture. Okay. What does this thrombosis means? Thrombo? Thrombo
Blood
has to
clot.
do with
Blood clot.
Clotting, blood clotting.
blood clotting. If there is issue with the blood clotting, that small blood can travel inside the blood veins. So it's better we take the capillary in these situations. Parkinson's disease or stroke. As we know, Parkinson's disease is a type of disease where the nervous system will be affected. So they will be having a completely shaky movement. So it cannot be controlled by the brain. The movement should be controlled by the brain, but this becomes a habit that it's not functioning properly. So they will be always shaking their head or hands, something like that. There's always a movement. What about stroke? Stroke is a condition where they cannot move. That's another situation. So this can affect the patient's speech. If you ask them their name, the words can be clear. So you have to ask the caregivers. Okay, ask the caregivers and make sure you check the legal documentation or legal proceedings before doing that and document it. Tremors or movements of hands can make it hard to hold. So ask someone to come and then they will hold it and then you can draw the blood. What is the mobility issues we are talking about? Some of them, old people, will be in wheelchairs. They cannot walk. And if they are in the wheelchair, make them, the wheels are locked, because in some situations, if you don't lock the wheels, you'll be drawing the blood. The patient will be a little bit moving to sit, and then the wheel will be going, and then it may lead to injury and all those things. The patient should be completely there in a still position, because we don't want needle prick injuries. Ensure enough space is provided to accommodate. Usually we have that like a trolley with a station. Make sure that trolley also has wheels. That also has to be locked. Sometimes you may be poking the patient, the trolley, if you don't lock it, it'll be moving to 2 kilometers. You can say, can you please help to bring the cotton back to me? It's not possible. It's your job. You have to take care of your surroundings and you have to accommodate accordingly. Floors should be non-slip. This is another thing. Free of any blockings and stuff. May not be easy for the patient to straighten arm if it's an old patient. Whatever they try to straighten, there'll be some sort of folding there due to arthritis condition or due to the muscular weakness or due to so many reasons for an old person. Look at both arms to see if one is better to use. Let the patient decide which position is comfort. Don't tell them if you sit like this, it'll be easy for me. Don't tell them, mainly the old patient, your comfort zone. Ask them their comfort zone, how they feel comfortable, in which position they are comfortable. Mobility. Some people, they cannot stand on their own. They need some support. So in such situation, if you want to make them sit on the phlebotomy chair from the wheelchair, that's also okay. If you feel you can help them, or else call another person to help. Often they will come with a family member to assist them. This is a reality. Continue to direct communication to the patient. So you can talk to the family member or the caregiver. They can talk to the patient, because sometimes when they are in pain, you may talk like for half an hour. It doesn't sit here. It goes away. Mental and emotional conditions. We talked about it. This is the worst thing I have seen. It's not under control. They are not in their own senses. They are not in their own control. Someone must help you, and someone should be with them also. A caregiver, a parent, if it's their children, if old people, their children who are adults now, they can bring them. It will take time when it's a mental issue. It will take time even if it's an emotional issue. So always assume that the elderly are of sound mind unless there is evidence to the contrary, which means the adults usually they know what you talk, they can grasp and everything, but sometimes it's not in their control because of the nervous condition. The nerve impulses are not traveling properly, so they get the message slowly. Wait for them. Or if they're coming with a caregiver, talk to them. They will convey the message to them. And the processing of the information can be a little more, for them, the processing of information is always going to be slow. So wait for their response. And even the reaction, even the stretching of hand is also, they won't show the hand right away. It will take some time. Give them that pace, give them that time. Don't compel them to stretch, don't rush them because they'll be lost. They don't know what to do. And then you also have to take more time in these situations because you don't know what to do. Even the person who's coming with them, they also don't know what to do if the patient is not cooperating or if the patient is taking their own time. It's okay. We know, we understand. It's an old patient. Everything is not under his control. On top of that, that patient is having a mental issue. Forget about it. Definitely the procedure is going to be long. If he is having emotional issues, they may cry. Sorry. They may scream. That's okay. You don't scream. We all know that patient is an old patient. Well, when do you think these conditions will happen? Such an old person and always someone should be there. All these things happen in the long-term care or in the, what do you call, the retirement homes. Okay. So there'll be some extra nurse to assist you. Or if you're working in the public lab, someone will bring the old patient to you. So this will take time. Have that sweet patience. Let go. That's okay. We are there to learn and do the job. So every day I'm telling you, as a phlebotomist, it's a special skill. So every day your job is to collect the blood for the diagnostic purpose. At the same time, you will experience all kinds of troubles. You will experience different disease conditions. You will experience people with different mindset, cultural differences. They will come and put that I cannot stretch my hand like this because in my culture, this is considered something dash, dash, dash. Let them speak. You don't interrupt. That's not our job. You don't tell them it's good. Don't tell them it's bad. You don't tell them it's okay. You don't tell them, oh, I don't know, nothing. Just, okay, just smile and say, okay. So the doctor, be strict in your point. Okay, that don't tell I want to the doctor has advised to take the blood and based on the requisition, I'm here to help you to collect the blood for diagnosis and so that you will be better and blah, 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 blah. Those type of statements are better than the personal statements. Which culture is good, which culture is bad, we are not there to assess. Right? Who is having the right mindset, who is not having the right mindset, we are not there to assess. That's not our job. We have better things to do in our life. Our job is to get the blood. Irrespective of the difficult situations, difficult veins, different scenarios, different infants, whatever, mainly dealing with the old people is hard because they're very stubborn. Another thing, they're very stubborn. They won't cooperate easily. Okay. And on top of that, if I have the mental health issues or mental issues, emotional issues, a little bit more harder. But it's not like we cannot do. Yes, we can do, but we need more patients. Clear? Yes or no?
Yes,
Yes.
Miss Clear.
Yes.
Yeah, we are talking about this because these are the adaptive methods we are going to use that in the along with the phlebotomy skills. It's not only poking and getting the blood. It has to do with the environment. It has to do with the people standing around. So working under pressure. This is what working under pressure. In the beginning, as a trainee, in the placement, you will experience this. Don't panic. It's okay. Let go. We are there to get trained. That's it. Okay. But use the words wisely and nicely. Give them the confidence you are there to help. Okay? Especially old people. If you tell them, can you stretch it? No, I can't. What are you going to do? No, 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 no. You have to stretch your hand. I'm here to take the blood. Without taking the blood, I can't go home. I have to document it. Nothing goes here. What they say, they say. Then tell them politely, give them a few minutes and may know like which hand you want to get the blood, sir. Ask them politely. Then if your words are polite, what happens? Okay, they will understand slowly and then they will cooperate. Even with the people who bring the old ones, it's not easy for them. For them also, it's not easy. But they know how to handle based on the experience. If it's a family member, son, daughter of an old father, they are used to. They will cooperate with you. Okay? So try to make the best scenario, the best situation. Try to be more productive in terms of collecting the blood, like think about different situations and use your logical reasoning skills over there. Okay? And then do the job successfully. That's what they want. Once when you become a trained phlebotomist, you will be a wonderful human being in the world. Why? Because you know people now. You know how to handle them left and right. You'll become expert. You will see, okay, this, I can do it. If I can take the blood from the old people, I can do this. If I can collect the blood from the mentally challenging person, oh, the others are magic. I can do that. This is the attitude you will be developing, which is a good thing. Of course, we can do that. That's why we are here. We are learning step by step. Clear? Any
Yes,
questions?
Yes, Miss Clear.
Any question? Just a question time. After the break, we'll start with the physical challenges. I want questions. No questions? Okay. Let me start asking one by one. Amina, questions?
I have no question.
Okay. Azinet. Azinet, no question. Christiana?
No, I don't have a question.
Okay.
No
Christiana,
questions,
question.
Miss.
Chris?
No,
Chris, no
thank you.
question. You're most welcome. Zarina, mine question? No?
I'm good.
Eveline, question?
no, ma'am. Thank you.
You're most welcome. Huda?
No questions, ma'am.
Joanna?
No questions, ma'am.
Kara?
No, ma'am.
Louis? Yeah, I can very well hear you. Every day is not the same day, okay? Just know we talked about it. So today is a good day. I can hear everyone. Rugiatu?
No,
Oh,
ma'am.
Maris. I missed Maris.
No, ma'am.
Maris.
Yeah.
Okay, good. Rugiatu?
No, ma'am. No question.
No question. Santiago? All
No, I'm
good?
good, thank you. Yep.
You're most welcome. Verna?
No question, ma'am. All good.
Ying Hong? Ying Hong, where are you? I'm calling your name. She went for a break already? Yusra?
All good, thank you.
Yes. Zenaida?
Hi, ma'am. I'm just wondering about the 16-year-old with a cognitive challenge.
Mm-hmm.
Did she consent her arm?
Yeah, after eating the candy, after asking so many questions, after telling the mother to wait, because we tried our best and the mother has to also talk to her. So it took 45 minutes to collect 2 tubes. But we did. But I called the supervisor already because for me, like she looked like a cooperating person, but her condition, oh, good. Thank you, Hingong. Thank you for the message. Her condition is that she doesn't have the capacity to understand and stay calm. She's pulling this, she's grabbing that. What if all of a sudden I'm poking the vein? Wait a minute, I want that. So what can I do? It'll be a needle injury, right? So we don't want those things to happen. So in these situations, we need witness, guys. When you see the condition is like that, ask another person, your teammate, a technician to be there. Okay, and an experienced person to be there because we are new. Once when you gain the experience, you will know how to handle, trust me, so you can assist someone who is new to the field. This is how it goes, like a cycle. But this is not like something you cannot perform. Of course we can do. Have a nice break till 11:30. See you at 11:30. Come prepared. I'll ask few questions here and there. But anyways, we have to learn. All good?
Okay, ma'am. Thank you.
All good,
Yes,
thank
miss.
you.
Okay.
Thank
Have a
you.
nice, wonderful break. Okay. Thank you so much.
Too.
See you
Thanks.
11:30. Hello guys, welcome back. How was the break? Not bad, good, okay.
Not
Need more
bad,
break.
ma'am. Thank you.
You're most welcome. We need more time. We need to sleep. Anything, any comment is okay. So ready to go. Waiting.
I'm ready.
So ready, Kara, good. Well, okay, only Kara is ready. Okay,
Oh, I'm ready.
okay. Good to hear. Okay. Oh, wow, good. Appreciate it. Any message from Alexia? Because she's not here. I told you before. Anything that she has to communicate? Is anyone there to take her message? No, because she never messaged me anything. Okay, let us continue. Just a quick attendance, please. Amina, Asinet.
Here,
Amina.
miss.
Yeah, Amina is not there. Needs more break. Oh, she's there. Christiana, there. Chris,
Here.
Zarina Mine. Zarina Mine. Okay, Eveline.
Hi,
Huda.
ma'am.
Hi. Nice to hear you, Huda.
I'm here.
Good. Joanna.
Here, mom.
Good. Kara already said ready. And Louis, ready. Maris.
Yes, mom, I'm here.
Yes. And Grace. Where are you? Grace is not here. Santiago. Yes, good. Verna. Where are you? Okay, she said the reason. Okay, Ying Hong, you can message me. Yusra is
Yes,
ready.
here. Yeah.
Yusra is ready. Two
Yes, I
people are
am.
ready, steady. Just we have to go. And Zenaida.
Hi, ma'am.
Hi. So, Grace, where are you? Looking for Grace. Arugiatu?
Ujat is here.
Here? Okay.
Yeah.
Okay, let's continue. So, any questions? You said no. Can I ask you a question? No, miss, we are tired. Please continue with the information. Tomorrow we can answer. We have to go through the information, something like that. Or it's okay to ask, miss, so it's okay, you can ask. Now, there's a quick question. Do you think as a phlebotomist, you're not speaking today? Why? Too much information going, processing takes time. More strong, okay. Okay,
Yes,
I
miss.
understand.
Me
It makes
too.
sense. It makes sense, okay.
Yeah.
Okay, just a quick question here. Do you think as a phlebotomist, we have to adapt according to the patient's needs or according to the situation, or we have to
Yes.
be stubborn with our
Absolutely.
procedures?
100%. Adapt.
Adapt. So we are learning about the adaptive methods and why there is a need of this changes. That's what we are looking for, right? And this is an important step when it comes to the phlebotomy, guys, because it's not a joke, but at the same time, I told you, use some logical reasoning skills within you and then bring that confidence. So once when you're well trained in the college lab, when you set out, mainly it starts with the placement, you will start the challenges. You're going to face the challenges. But if this skill is perfect, if you're if you're really, really good, if you're trained good, then that procedure will be good as well. So you can land peacefully, you can utilize the everything that's there peacefully, you can bring the concepts in your mind clearly, and you will have a clear knowledge of what you are doing. Okay? And there's another thing that I would like to tell you. It depends on the protocol of the lab. If you're working in the life lab, follow what they say. If you're working in the hospitals and hospital setting, it's a really challenging setting for the phlebotomist. And you learn a lot comparatively. And another, the second option is a clinic. In clinic like MCI, every time it used to be busy. I started in the MCI in Bramley Towns, Bramley City Center. It's 9 to 9 functioning, 9 to 9, all the time busy, loaded with patients and variety of patients. I learned a lot. So if you are in a busy situation, don't panic. That's a real thing, real place where you're going to learn a lot if you are a good learner. Okay, and this is a beautiful skill, so don't lose the skill. Just try to be in this field. It's very, very helpful. Mainly while seeing the other people, we realize how important it is to be a responsible individual because we are blessed with everything. Okay, take this as a model. Okay, so physical challenges. What do you come across with the term physical means? What comes to your mind? Physical.
Skin.
Hearing problems.
Hearing, anything that has to be done physically as an individual. Right? So if there is any challenge in that, we call that physical challenge. Mental means it has to do with the mind. Physical means the function, the normal function as an individual. When we have certain challenges, then we call that physical challenge. What comes to your mind as a physical challenge? Seeing, do you think it's a physical challenge?
Yes.
Yes.
Hearing?
Yes.
Mobility
Yes.
of hand?
Yes.
Yes, all these comes under walking.
Yep.
Yes, so all this, like the performance of day-to-day routine activities, when there is any situation, when there is a problem in these things, it's called the physical challenge. Mental challenges are different. That has to do with the acquiring the information, processing the information, and acting accordingly. That's the mental challenge. So you have to be prepared for both. So acuity is the ability to see, hear, and understand. Some people pronounce acuity, so it's all up to you. So basically, if you see, hear, and understand well, it's good enough. Some patients have a little ability to see. I mean, they cannot see clearly, but you know, nowadays there are so many adaptive methods where they can utilize that to function normally. It's thanks to the medical field. A big salute to the medical field. In previous days, when we grew up, we saw different challenges. My background is a medical background. My grandfather was a physician. My father was into the field, but I have seen different people with different situations. This is something which is not new for me. This is not like a new thing for me. I'm actually used to all these things. I have seen different situations. But the thing is, the difference I'm seeing now in comparison is now there are wonders to help the people who are in need. We have a special category like the special needs. We have a special category even in schools, special needs, spec ed, right? And there are people to help. There are some organizations who are non-profitable, they can help. In those days, no, the challenges were challenges, and that has to be taken care of. Some physician, when they direct the person in the household, they get the information. Otherwise, there was no internet. Do you agree with me? Like what I'm trying to convey? No internets, no Googles, no Wikipedias. They had the encyclopedia, but the encyclopedia is to gather the information about some things in particular, not for these things. These are the challenges that should have been addressed long time ago. So, but it wasn't that easy for those people. I know many of them, they ended up with the same life condition, suffering, struggling. And there are worse situations. The children, they don't take care of the adults. As parents, they just ignore them, they dump them because it's a burden for them. But now the human rights has like alarmingly has developed. People talk about their right. When you go outside in the settings, you will be wondering, you'll be surprised to see people talking about their rights. They will tell you, this is my right. In those days, we never had these things. Okay, suffering is suffering. They suffered. But now we have special hearing aids, even when it comes to hearing, special seeing aids when it comes to seeing, even the walking stick, they have some sensor, something to tell them, hey, there is a danger. It's amazing. I always admire the development, the positivity that's connected to us. So it's a big salute to the inventions made by the people to help others. Okay, so we are living in a very beautiful period. So I hope in future there'll be more advanced mechanisms that will be helping the people in need. But there are quite challenges I'm seeing nowadays. The diseases and disorders are also unique, new. In previous days, I saw when I was a child, plague was the common thing that appeared, plague, the bubonic plague, some other plague, flu type of flu, like the Spanish flu, I've heard about it. People just eradicate it like masses. They have to just bury them and all those things. Now we have the monkeypox, we have the Ebola virus, we have the dengue fever, we have the, you name it. And then we have this COVID, the SARS came, right? And still more mutant varieties of viruses are coming. I don't know who's going to be the next virus. So the challenges are unique. So moving forward, so we should have the ability to see, hear, understand, and some combination of all the three is what you call the acuity. So what do you understand by the hearing impairment and deafness? Something wrong with the internal structure of the ear, or something is not functioning properly, right? Maybe that part is missing, or there's something wrong with the part that's helping in the hearing. Maybe the fluid is not there. There is a fluid that has to connect the messages or convey the messages. That's not there, the lymph fluid. And there will be some bones called ossicles inside that has to, while hearing or receiving the sound, that has to move. Maybe it's not showing any movement. So all these leads to impairment, or sometimes it's missing. It can be due to environment, some accidents, or some hereditary conditions. So all those things help. So when someone is inventing something based on all these research, they make some device that helps in acquiring the information. That's the breakthrough in the medical field. That's what is happening nowadays. Now, when there is like a deafness or impairment, there came the sign language. In those days, we use our own rough sign language, mainly the family members. If there is a grandmother who cannot hear, the grandchildren will come, they will address the issue. But now there is a common course for the sign language. People who are interested, they go for that, and then they help the people who cannot speak properly, who cannot hear properly. So by the lip movement, they can hear, and then they can get the information. Again came the COVID, where the mask came into effect, the PPE. Now the lip movement also is gone, right? So we face that situation also. So anyways, like when you're in this field, when you are a phlebotomist, when you're performing the venipuncture, you should know how to overcome these barriers in order to communicate with the patient and how to draw the blood. So loss of auditory hair cells that amplify sound converted into electrical signals which are transmitted to the brain, everything, even this is missing, then that will be a problem, as I told you. And because if someone is not hearing properly, the communication is definitely is going to affect if they are not aided properly with the device. Okay. And mainly some people, they, what do you call stuttering or stammering? They cannot pronounce certain words. That's also a big issue. You might be seeing some people who cannot pronounce certain letters properly. So the communication will be affected. So all these things is actually associated with the brain taking the information, and the associated organs which are involved when it has some defect, these things happen. So you should know as a technician. So the hearing loss is not a big thing now, because as you grow old, we get a situation called there'll be hearing like a sound, a bell in the ear. We call this tinnitus. Have you heard about this? Yes or no?
Yeah.
Yeah, what you have to do when it's
Yes.
hereditary, if your grandparent have this, then definitely you should be aware of this. You have to be alert, go get the necessary device, talk to the doctor, talk to the specialist, you'll be helped. And the worst thing is you have to change the batteries. If the batteries are growing weak, the other person will be talking and talking and talking, and this person will be looking at the face, because it means you have to calculate, okay, this is here, but something is wrong with the device. So device is a device. So you have to be aware of this. Don't tell them, I've been shouting for the past half an hour. I've been spending my energy talking. You don't hear me. All these words are not no good. You have to act accordingly. Okay, this person has an 8, but something is wrong. So you have to bring the caregiver or someone. So tell them that this is what it has to be communicated. They will help you. Always seek help. And what you have to do as a phlebotomist, first try to speak clearly. Okay. When they hear, for us, it's easy. For them, it's little bit, it's like a tedious procedure. Like they have to focus more to get the sound for each and every letter. For them, it's a big thing. It's a challenge. So have patience. If they see if they show with the sign that they can't hear properly, don't scream. Just use some method, gestures, just to make them understand. But calm, you have to be calm. You should know, okay, this is the situation. This is how I'm going to act. Move closer and face the patient when you speak. Okay, don't rush. Speak clearly, distinctly in a normal tone. Don't increase, don't decrease. Never ever do the shouting business when you're in a job. It's a big no, you have to go home. So shouting raises the pitch of your voice and makes you harder to understand for them. But generally speaking, your tone should be polite, calm. Allow the patient time to answer questions. Confirm responses to avoid misunderstanding. If they're asking something, it's okay. Repeat, it's your job. Okay? And what if 10 patients are sitting outside? You have to rush? No need. You don't have to rush. If you can take care of 8 patients in your time period, that's fine. Let the others handle. There'll be different sections in the lab. Let the other person handle. Depending on the volume of the patients who are coming there to get the blood work done, there'll be more technicians to take care. You don't have to rush. You're not the only technician in the world to take care of so many patients. Your job is, when you're doing something, do it perfectly, without errors. Now, don't ask me human error is possible. Okay, one student asked me, we are all humans, human error is possible. I do understand human error is possible, but if it is like once in a while, it's acceptable, but not all the time human errors are possible. No. Okay. And ask patients to confirm their name only. So in this case, if it's a deaf patient or hearing impaired patient, don't ask their whole history. Just ask their name. Spell the name, first name, last name. Don't go for date of birth. It's okay. If someone is accompanied, ask them. But you document it. The patient who is here has difficulty hearing. Okay, got the first name and the last name. And if a hearing impaired patient hears only partial communication, he can only hear the half of the thing, they may agree not fully understanding what they heard. It's okay. Cooperate. Assuming that all elderly are hard of hearing, you have to hear it says when it comes to a geriatric patients, definitely 60% of them, they don't have the proper hearing. I think nowadays, because we use the youth, the young generation, they are already with the headphones, okay, high volume music. I think when they reach 40, everyone will be lined up for the hearing aid, I think. It's a reality. Research has proved that this is not okay. But the young generations, majority of them now, they are crossing the road. I have seen they are crossing the road with this thing on. They don't even see who is next, which car is coming, which car is going. They don't care. They think this is the green light now. This is the sign that I have to walk. Who cares? I have seen one person opening the book, reading and walking. I don't know. That's 2-in-1 miracle. For me, if I walk, I cannot read. There's a vibration. This is sort of movement. And I have seen this lady who was very young. She was like holding the book open. She was walking and crossing the road. I said, wow, some miracles are happening in our society, right? So it will affect the eyesight. TVs, putting more time in front of the television, front of the tablet, front of the phones. How many of you are parents? Parents with young children, with the tablets, phones, they discuss a lot how their children, how they're behaving, because it's behavioral issues. It's not normal. There is a time where you have to sit, you have to focus. There is a time when you eat, you have to focus on the food. There is a time when you go for something, grocery, do the grocery properly. There's a time when you have to write something, sit for half an hour, take your time, do everything, divide and use your time wisely, not all the time attached to your cell phone or attached to your tablet. What is happening, you don't know. Who is dying, you don't know. Who is going like starving, you don't know. What's happening outside, don't know. And they will simply give the reason also. Have you checked outside? What's the temperature? I don't know. What are you going to eat? I don't know. What did your teacher ask to do today? I don't know. Why they don't know? Because they're busy. Now, okay, to talk about this, it's okay, the young generation, let them continue, but the amount of disorders, the amount of impairments, when you go to the hospital, you will see. When you go to the sick kids hospital, you will see variety of problems with the children now. It's alarming, not a joke. That's why Canadian government has introduced one more day, family day. Take your family, go out, enjoy, be with them. Encouraging to go visit the campsites, enjoy nature. There are campsites without any electricity, without hi-fi. Do you know that? No Wi-Fi, no hi-fi, nothing. It will be just like trees, natural environment. Do the camping, enjoy nature. Clear? Why all these things can be avoided. Turn your back to the patient while talking. This is another thing. You don't even know the patient if they don't receive the communication effectively, then at least they will look at your lip movement. Now, when you're talking to them and you're preparing the station, it's a big no, because somehow there is a possibility of getting some information. You're blocking that. Now ask me a question. What about after COVID, miss, we are wearing the mask? Yes, the same situation. That's why when I talk in the class, I have to pull the mask. Because the sound will be blocked and then I'll be telling something, you'll be hearing something, and then miss, we all look like we have a real problem in hearing. So we don't want that to happen. That's why we teachers, we pull our mask. We decided to because we are also taking risk. Why communication is very important. Okay. So as it says, most hearing impaired patients, they see the lip movement. Hard if you're wearing mask, it also says. So the better thing is we don't want this virus. We want our immune system to be strong, and we don't want this PPE, the mask. Mask is terrible. The other things are okay, but mask, I really feel sometimes oxygen supply is not going properly according to me. I feel suffocated. I have to pull a little bit, breathe the oxygen, and then I have to fix it. What if people who have real lung issues and other horrible situations when you wear a mask, right? Now, anything to ask about the hearing? Miss, we are clear. We want to know about the seeing part. Okay, visual impairment. What is visual impairment? Anything you see, right? Diminished ability of lens to adjust, because these are telling the reasons. What could be the reasons? So you don't have to specialize in this. We're not going to be the ophthalmologist or eye doctors, just to know. That's it. The basic information. Clouding of lens or cataracts, mainly people with the diabetes, they come with the cataracts or glaucoma, whatever condition it is, they cannot see clearly, blurry, dim vision, cooperate with them. And some people, they cannot see the light properly, so they're mainly the old patients, right? So the eyes will be coming like dim, and then they try to struggle to close the eyelids. In that case, ask them what can be done. So dim the light if you can, or bring them into a situation where they can be comfortable, and then they are ready to cooperate with us. And some people, this is another thing, night blindness. There is one hereditary condition called night blindness. They cannot say, they can drive till 6 o'clock or 5:30, they are fine to drive. And after that, in the summer, generally speaking, after that, when there's little bit solar radiation going down, they cannot see, That's it. And what about winter? If it's a gloomy day, dark day, definitely they cannot see. Someone has to drive for them. All these type of patients exist. They come for the phlebotomy. Be careful with them. Make sure they come with someone, and they have to walk with someone. Okay, and then document it. Document. Our job is not to mainly see who comes, who goes, but we have to document, okay, this person has this issue and this person came with a person assisting them. It's helpful. Can come in varying degrees of loss of vision, legally blind. For legally blind, sometimes they walk. I have seen people walking with a stick, legally blind, but they have sensors. Okay? So these things you will come across. So cooperate accordingly, talk to them nicely, be polite. Patients are patients, especially old one. You have to be more careful, more patience. More patience and softness in your voice. It will help them. Be prepared to help. Always have the tendency of helping others. Okay, people who have the tendency of helping others will be the best healthcare professionals. Okay. Be prepared to help provide adequate lighting with no glare. This is what we are talking about. Guide the patient to the collection area and back, or to the washroom if appropriate for urine collection. Because as technicians, if the requisition demands urine collection to check for something, if the doctor has insisted, if it's been prescribed, just tell them, come with me. Okay, please have a seat. Okay, take them to the area, show them where it is. Okay, and give the instructions clearly. Provide written instructions in large print when available. When some people, when they cannot communicate or lip movement, they cannot understand, they cannot hear, write it in bold letters in a paper. Okay, and narrate the procedure as you're performing the collection. Just tell them this is what you're going to do. If they are good readers, they can read. It's a big help for us. They will read and understand. This may help to reduce anxiety of waiting for the puncture. But you have to ask me, You have to ask me. I have to give this tip to you every time. What if the people are blind, miss? You told us to write it in a big paper. For the people who are just blind, legally blind, you don't have to bring the Braille method to write the Braille paper to write and to just touch and see. There'll be someone accompanying them. Tell them. Right? Yes or no?
Yes, miss. That makes
If
sense.
no one,
Yes,
yes, if
definitely.
no one is there, that person came alone. He asked someone else, no one to take care. If he's coming alone, that's fine. At least if you can hear properly, tell them clearly, communicate with them
Yeah.
clearly that this is the procedure, this is what we'll be doing. They will understand. Okay?
Oh, okay. Okay.
But
Thank
Okay.
you.
what you have to do, in this case, you're taking the blood, okay, everything is fine. The person is blind, you communicated, you took the blood, and what do you have to do?
Document.
Good job, document. Okay? Okay. And avoid using gestures when speaking. When old people, when they have difficulty hearing, they are telling you avoid using the gestures because I think that they'll be distracted most probably. Okay, so that could be the reason. And the volume of your tone should be under control. Don't scream, don't raise your voice. Okay, so these things for mainly for the seeing problems. Because we talked about the visual impairment, even if you're using gestures, if they cannot see, they cannot see your hands. So just speak to them and very clear, they will understand. So tell them you have to remain calm throughout the procedure and then explain it to them that's something that you're going to touch and poke. Okay, you're going to poke, explain the situation, explain the procedure to them, and then it'll be helpful. If definitely someone should be there with them when they come for these situations. If they're coming alone, you have to document, but you have to be more careful. But even if they're coming with someone, document it. Because these are not the normal situations. These are the situations that you have to do it successfully, politely, taking your time, your energy, but the doctor should know that this is the condition that you have noticed and this is what you have done, which means it shows the doctor knows about the patient, of course. It also reflects that you are aware of what you have done, and this will give a clear communication. When the doctor wants to ask you something, he may call you and ask you. Okay, so this is if you don't document it, it is considered an error. So generally speaking, as a technician, these are the things that needs documentation. It should be there for some purposes. If the doctor wants to ask you about the behavior, what they may. So in this situation, you have to document it and then you have to write it. So they will double check sometimes, they will confirm, they can order for other tests. So it's good if you document it. Clear? Any questions? No question?
No question, ma'am.
No.
Thank you.
Okay.
Good. What is this cognitive challenges? I told you what does cognition means. Cognition.
Have they
Like
have
issues with the brain,
Issues with the brain, a processing of the information.
the processing, yes.
Processing of the information and the associated behavioral changes. That's totally called cognition, cognitive challenges. Now tell me, in old people, we are talking about the geriatrics in old people. Do you think there'll be more cognitive challenges?
Yes.
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 What could be the reason?
Alzheimer's or dementia?
Alzheimer's,
Against
dementia, nervous disorders that's been
Yeah.
progressing in them, right? And
Right.
frustration because now they are left out, they can't do much, inability to work. Like when they were youth, they were very active, energetic. Now, because of some reason, they cannot function the same way. There's a frustration, and following the frustration, there'll be depression. There will be depression. Yes or no?
Yes.
Yes. So that is also hampering the normal routine. And now another added frustration for them, they are dependent on someone that they don't like. Dependent on someone when you are used to independence all the time. You take your car, you go, you enjoy, you drink a coffee from Tim Hortons, you buy whatever you want to. Now for everything, you have to tell someone. And sometimes the someone could be your daughter, your son, may not be cooperative. Now they are frustrated. And now they have some problem in the system. They have to come there to get the blood work done. Definitely you can't expect anything normal from them. I have seen old people throwing something, sometimes the plate, sometimes the food, sometimes the pen. It's a frustration. Bear with them. Okay? Don't ask them, how dare you can throw this. No, it's not our business. Our business is to stay calm, talk to them politely, making our job successful. What is our job?
Blood collection.
Blood collection. We are collectors, right? Good job. And this, trust me, the cognitive issue will be a big challenge for you. Always ask someone to be there with you. Now, involves knowledge, the development of intellectual skills. Sometimes children who are mentally retarded, they grow as adults. Definitely some other person will be bringing them to the blood collection. These are things are a real challenge, but the thing is, if you are a really good human being, you'll feel the pain that, and you will see how blessed we are. I'm telling this repeatedly because this is not easy. To see that thing is also not easy. Right? Memory might have been affected, communication might have been affected, the reasons for cognitive issues they are addressing here. Even for the basic things, they have to depend on someone, right? And you as a technician, when you get the name, that will be hard because they don't tell the name. When you ask them, especially the autistic people, they will laugh and then they will tell some other names. So better you ask the caregiver and document it. If they have anything like a card, like for example, definitely they won't be having the driver's license, the health card. I mean, you have to take this as a proof of the name rather than asking them. It's waste. If they can, some people, they can tell the name properly. That's fine. Take them, just be like, talk to them in a very positive way. So some people, they engage them in a pretty little conversation where they laugh, they joke, and they also enjoy. They feel happy, they feel comfortable. Give them that pace. Give them that compassion. It's important as a human being. Ask a family member or healthcare provider who's familiar with the patient to positively identify them. Usually they come with someone, so it'll be fine. If it's in a hospital setting, definitely the nurse will be there with you. It's better. You will have to document this on the requisition. I told you, documentation, 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 documentation is our job, along with the collection. This cognitive issues, once again, it's a repetition, dementia, Alzheimer's, Parkinson's, strokes, brain injuries, Down syndrome and all, they are the genetic disorders. There are so many genetic disorders. You will be seeing different kinds of brain disorders, or you would say chromosomal disorders, which has affected the neurological developmental abilities. Okay? And there is a special branch of science that now it started neuroadaptive communication. A neurological adaptive communication, which means people who have challenges like this, when they come, how you communicate. There's a special branch now that's been existing, which means to help them and also the healthcare professional to have an effective communication. It comes under the communication category. You have learned this in where? I'm not going to tell. Neuroadaptive communication.
I think it's the ethics class.
Ethics, very good. In ethics, that's a separate topic because now it is in high rise, which means it is there. People are suffering. People want some help. So there is a branch that's been existing now. It's been opened to face all these challenges, to make the communication effective, helping them, helping the others, mainly in the healthcare setting. Any question? No question? You guys don't like to talk to me. That's why you're not asking questions. You should talk, right? Okay, next. So moving forward, I assume you all know what to do, how to perform the phlebotomy when it comes to the challenging situations. Can we move forward to collection sites to avoid? Now, what are the sites that we have to avoid? We already know. Yes, Eveline, anything to say?
Nothing, ma'am.
Nothing. Good.
Yes.
We already know the sites to avoid. We have been talking about this, right? And especially when it comes to the old people, there are slides which will show like how the veins will look, and even though it looks good, the veins are very clear, it will roll easily when it comes to old people. Why? There is not enough elasticity to stretch, sclerosed, hardened, collapsible, so many things. Okay, so can you do the venipuncture on the burned areas? A big no. On scars, no. On tattoos, they say yes, but if the tattoo has some bruised thing, or because of the tattoo, if there is an infection, you cannot touch it. So newly burned and tattooed areas are prone to infection, are very painful. It'll be painful for them. I have done so many venipunctures with one lady, young lady who's almost like who was almost 24 years. I struggled to take the blood because of the tattoos. The tattoos were so intense. I was looking for the vein. It was a deep vein, right? But that patient was very cooperative. The beauty is the patient admitted, okay, this is a mistake because now I'm struggling to find the vein. I told her, you could have left some spot to look for the vein and to record it in the mind, because the color of the tattoo blends with the skin and the vein is deep and it keeps on rolling. I struggled a lot to get the blood from her. That one incident I will not forget. Tattoos are okay, but it is horrible when it comes to venipuncture. You will feel the frustration. Okay? So this is another thing, but it's okay for them. But for us, be careful. Okay? Excessive scarring may be hard to find the veins. Excessive scarring, excessive tattoos also is hard to palpate and find the vein. Right? Sometimes we palpate, we record the area in our mind and we'll be ready, but you cannot record nothing. Especially when it's a deep vein, again and again you have to make sure. So what I did, I told her, go out, like drink water, come after 2 hours. She went, she agreed, she came, I took the blood. But it wasn't easy. Damaged veins will feel hard and like a thick cord. Okay, and then they won't bounce. They'll be very stubborn, like a fixed piece of thread, something like that you will feel when they are damaged, sclerosed. Why it happens? Maybe due to venipunctures. Repeated venipunctures in the vein also leads to that condition, sclerosed veins. People who poke the needle to get the drugs, people who have addiction to drugs, their hands will be horrible. Then it will have impaired blood flow. The blood flow won't be proper. Never mind the blood flow. When you see the veins, you feel that how am I going to poke? Where to poke? So the handy will be the capillary puncture. So all in these situations when it's really hard, then definitely we will think about the capillary puncture. We have no choice. And also avoid the swollen areas. Edema means the swollen with the fluid, excess fluid in that area. If it has edema, don't poke. The fluid comes along with that, the results will be definitely not the qualitative ones. So avoid it. Swelling caused by abnormal accumulation fluid in the tissues collected from areas like this may result in inaccurate results. I told you, so better don't touch. Hematoma, when it's bruised, the flow will be blocked. We have experience with a couple of students. Okay, I told the student, another student to poke in the area below that. That student went on the same small hematoma area. Blood flow was 0 because it blocks. Hematoma means the clot will be there. Blood clot will be there, minor clots there. But when you poke it, it blocks the flow. Sometimes the blood will come, but a piece of clot will also enter inside the needle. That will block the flow of the blood from collection, or it will give inaccurate results. So better avoid that. Swelling or mass of blood often from the leaking puncture site, going through the vein or not applying enough pressure to site. These are all the reasons for hematoma. So it's not a good thing. Collecting through a bruise can be painful. First thing is it's painful. Lucky that student never complained. I thought maybe she'll feel the pain. No, that's a very cooperative student. I don't want to tell the name, but she never said anything. She said it's okay. Okay, so again, if you're getting the blood from the hematoma area, not only the challenges of the clot will be there, the blood that you collected will also be hemolyzed, right? Because it will then, what will happen is okay, but the quality of the results won't be the same. This is the hematoma. For some, the hematoma can be worst like this. Can you see the picture? It spreads. In the previous batch, I have seen students like this. I have to give them the ice treatment. If they keep ice continuously for a week, then it became normal. But it happens. So when you see those, mainly what happened for that student, another student with the instructor, I wasn't there, with the instructor, they poked the, the sensitive area. Which one is the sensitive area? First, we give preference to the antecubital, then the cephalic, then the basilic. So the other student poked the basilic vein. So what happens, this basilic vein is very sensitive to some people because the skin here is very thin and it is with the close vicinity of the nerve endings. So you have to be very careful. Okay, so in case if we don't get the blood, we find that as the best option, then immediately give them the ice pack. Ice pack. They have to keep ice. Clear? Have you seen the picture? What happens where the
Yes,
vein is,
clear.
where they have poked, and what happens? The blood is leaking and then it's becoming a clot. So we don't want these headaches. So when it comes to hematoma, what is hematoma? I'm asking you. What is hema? Hema means
Blood.
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 Hemato means it's related to blood. Oma means
A condition.
A condition. Carcinoma, cancerous condition. Hematoma, a condition of the blood where there is something happened. So this is the definition for hematoma. So pooled blood within the arm is the reason. Can migrate. See, this condition can migrate to other areas, okay, of the extremity. That's why the whole hand becomes bruised, or the hematoma can be seen. Can cause compression or injuries to nerves. So that's why the basilic one is the last that we give preference to. If notice it forming during the collection, stop and apply direct and firm pressure. Why pressure? Because that shouldn't spread. That should be there intact. If forming after the collection, apply direct and firm pressure and keep the ice. Okay? And can bleed under the skin, can bleed out of the puncture wound. So these are all the possibilities. So basically you can see that, you can visually see the changes in hand. So mastectomy, this is one important question that you will get it in the ML-POW. What is mastectomy? Removal of the breast due to some cancerous conditions or tumors. So that area, in that particular hand area facing that breast, you cannot draw any venipuncture because now the lymphs that is associated will be more prone to infection. So anything which can cause infection, it's more likely to be, like, for example, 80% more choice of them to get infected. So if the person is having this condition, the doctors will warn them, they will give you a note. So when they come with a note, avoid that hand and take the other hand. What if both the things are affected? Then you go for some other site, like the capillary site can be the best option, not the veins. Clear? Never collect blood from the same side as the mastectomy. It's very critical. ML-POW question. You should know this as technician. The lymph node is often removed with the breast, so there'll be lymph duct, but the nodes where the activity has been performing, it won't be functioning normally. So infections are more prone to happen in these type of patients. Be careful. Impaired lymph flow can make the arm swell or prone to infection. Once again, if double mastectomy, consult with your physician, which is the best thing to take the blood. They will mostly they will go for the capillary. Clear with that point? That's an important question, ML-POW question, a question that you have to consider, and an information that you have to think more about it. It's very important as a technician. Okay. Our job is to help the patients, not to give them more trouble. We don't want infections. We don't want them to see again in the hospital ward because of we did something happened there again. It's a big no. Obese patients. What about the obese patients? What do you understand by obese? Obesity?
Overweight. Yes.
Overweight. You know the weighing scale, the manual weighing scale, it can take up to 200 kgs. No, sorry, 200. Yeah. One patient I have seen for the first time in my experience in a clinic, the patient is around 250. I think 250 pounds, not kgs. So, yes, sorry. So the patient was standing there. The doctor told me to weigh, but this patient was standing, and then the scale is not cooperating because it's going beyond. So what about this condition? If you have this condition, how to check the weight? What will you do? And there will be a chart. It's a physical chart. You have to note down the pulse, the heartbeat, and everything about the patient, the breathing, what do you call the respiration, right? The respiration, everything you have to record as a technician. You'll be trained for that if you're working in a clinic. You have to check the height and the weight. This annual chart has to be made by the technician. And the doctor told me to do. For the first time, I don't know what to do because the scale is not taking her weight. She's going beyond that.
Miss, I was thinking if, let's say, the scale goes up to 200 pounds, if there's an option to change it from pounds to kg,
Nothing
the
works.
scale?
Nothing works because the kg will be associated with the pound under.
Oh,
There's
yes.
two scales.
Yes.
I came to know, this is an information I'm giving it to you. I came to know on that day there's a special scale existing in some healthcare situations or healthcare areas or labs. And there's a special name for that. And then they go there, the doctors will send there. So they have to go there, check their weight, and that will be sent to the physician. Then the physician will tell you to record it in the computer or in a document.
Wow. Okay.
For your information, on that day I
Yeah.
was listening to the doctor. Oh, okay. I don't know about this. See, it's a learning experience. That's why
Yes.
I'm telling you. Don't panic. It's not your job. What if the
Okay.
weight is not taking? Okay, it's not your problem. But the thing here is don't tell anything negative to the patient. They may become offended. So be careful. Let the doctor know that's not the weight is, you cannot take the weight. He will understand because the doctors are busy. We have to help them to do all these things. So whatever you have noticed, document it, give it to the doctor. They will take care. They will tell the patient where to go, what to do, how to send. Then you put the information. If you're working in a clinic, you will come across patients like this. Only one patient I have come across in my experience so far. Maybe due to different health reasons, but it's not our concern. Our concern is now imagine drawing blood in that patient. Another challenge. Yes or no?
Yes, because their veins are more likely to
Yes.
roll,
So
right?
in those situations, the doctor will sometimes decide to tell you what to do. So they probably go for the capillary puncture. No choice.
Okay.
Okay. So veins may be deeper, harder to find, may have to use a longer tourniquet or double. To some patients, I have used a double tourniquet. This was taught by another technician who was working with me. So double tourniquets can be tied if its veins are like a little bit deep. It will pop up. You don't do that now because it's a learning. In learning, we are not going to experiment with each other. Be careful. Okay. So why they do that? They say if the patient is obese, the first challenge, sometimes this veins can roll. So they want to secure properly. So double tourniquet. Clear? These things you will follow in the real situation when you're working, not in learning. In learning, the simple way. Yes, Christiana, question?
Yes, sorry, one question. So in that case, would you document that you were unable to weigh the patient?
Yes,
Okay.
documented.
Okay.
Look at the antecubital fossa area first. May have to check for the cephalic vein for easier access. So they will, anyways, we have to struggle because for the obese patients, one thing I have noticed, the antecubital area is very hard. We look for the next option, that's the cephalic. In cephalic, there are chances you get it. Okay. And what if the patient is paralyzed? Loss of muscle function is there. So it can affect of course, you won't get the proper blood flow and more chances of clotted blood, a condition where the platelets are not functioning properly. Now, in these situations, follow the CLSI guidelines strictly. How to collect, what is the procedure, what is the alternate sources, where you will get this information. You will get this information, any idea?
That will be also, ma'am, under the standard procedures in the lab.
In the lab,
But
standard
also
operating
the website.
procedures or SOPs.
Yes.
If you go to the SOP area in the shelf, there'll be a blue book called CLSI guidelines will be there. Wherever you'll be working, it could be as a phlebotomy area, it could be a clinic, it could be life labs, it could be like a Dynacare, it is a med lab or whatever, Intrepid hospitals, there will be this guideline, standard operating procedure. Just go grab it, read it, follow. Before that, they will train you. That's the thing. So when they actually hire you, They will tell everything, what you have to do, what you should know. Based on that, there will be some questions to assess. They call it assessment of the new person who has been hired, newly hired. And there'll be a test or assessment. In that, you have to pass 80% and above, or else you sit there, do it again. If you're failing 3 times, they don't tell you to go home. They will make you understand what's wrong with you, what you need help, how you can get the help, and then you'll be there. But you as a technician, it's your job to read it, go through it, and do the assessment. Clear? Or as the supervisor or manager will come and talk to you, tell what do you need, what's the difficulty for you, why can't you take this information, why you're getting below 80, 80 is the passing score and all those things. But this is not a problem. It happens, but it's okay. Your job is to take the information and then to do the job properly. That's it. They're not going to tell, okay, you failed 3 times, 80% and below, go home. No. But as a phlebotomist, as a technician, you know the result. For example, me working in the core lab, I know the result of the patient. I have seen the result. And that person is my close friend's daughter. Now, I'm calling my friend, I saw the results of your doctor. This is then if they came to know, then I'm going home. Getting 80 and below, failing, is no big deal. It's okay. I can stay in the job. But if I am giving the information to someone else, breach of confidentiality, I am accountable. In that case, if someone's health information I'm leaking, going home. You may be experienced technician, you are doing magic in the field. Without you, the phlebotomy is not possible. Everything can be there. There can be a piling of record of your positivity, your talent, your skill, whatever it is. But as a healthcare professional, a big no to exist in that field. Right? I have to go home. Clear?
Yes. Yes, clear.
Yes, ma'am.
Clear,
Very
all
clear.
of you?
Yes,
Very clear. Thank you.
Yes.
Clear.
Getting
Clear.
80, clear, 80% below is not a big deal. You can do it again. You can ask so many times. You can bother the other technicians. Okay, that's not a problem. They will get a little bit irritated, annoyed. That's okay. It's not a problem. They won't tell you, okay, now you can't work here. But if you leak the information of a patient, you are going home. Clear?
clear, ma'am.
Okay, now, additional blood collection challenges. What are the additional challenges? Fainting, syncope. This, we will talk again and again about the syncope because you will be coming to the sim lab at the end of the course. I told you, I'll be dealing with the sim lab. I'll be with you with the sim throughout the procedure. Again, there is a skill book provided to you where you have to go through the information. You have to write about how will you take care of a patient, a fainting patient? How will you take care about a nervous patient? How will you take care if the patient is having some other challenges? It will be revised again because this is considered something really, really important. So take the tips now. When you come there, I'm not going to explain. I'll ask you more. So you are going to talk and I'll be sitting there. Okay, taking the answers from you, which means it's important. So syncope or fainting means a loss of consciousness. It can be due to because the patient might be tired, dehydrated by the time they come there, or needle phobias, or some anxiety issues that they cannot take, some sort of stress traveling to their brain that they cannot take it, can lead to syncope or fainting. But how you as a technician has to deal. That's the main thing. How will you deal? It may happen if it's ill, fasting, stress. Some people, they cannot see the blood. You know that? Some people cannot see the blood. They faint instantly. And it could be dehydration, anemia, emotional distress, hypoglycemia. What is hypoglycemia?
Low blood sugar.
Low blood sugar, very good. Fatigue, general fatigue, because overexhausted. They worked for so many hours the previous day. They had to sleep, but they never got enough sleep. They are now in the phlebotomy area. They have to do this because they want to know what's happening with their bodies, all these conditions, right? And fatigue, medications, some medications, they have to sleep for 8 hours, but they never had the proper sleep. They have to come early in the morning. They have to check the fasting sugar, all these conditions. Okay, they can lead to syncope. And always ask the patient if they ever had any complications with the previous collection before the procedure. Now, who mandated? Where did you get the guidelines? We talked about it. Now you're going to answer.
CLSI.
CLSI, good. What is CLSI?
Clinical Laboratory Standard Institute.
Institute. Which year they mandated?
2017.
Yeah, very good. 2017. Have you done this before? Or how about your blood work before, right? So all these questions. Don't ask them directly, will you faint if I draw the blood? How does it look? It sounds good as a professional. Oh, you guys are not talking.
No, miss, it doesn't sound good.
It
No.
doesn't sound good. It's unprofessional, unethical, very harsh, rude, direct. No direct. Right? So if they say they felt faint or have, no, they will bring up, yes, last time when I felt this. So it means it's like you have to be careful. But I would suggest when you come across these type of patients, there'll be a room with a bed next to the phlebotomy area. So take them there, tell them to lie down peacefully. Your stress will be saved, and the patient's stress will be saved, so you don't have to go through all the stress. We don't have time to take stress, or we don't have extra energy to take stress. Do peacefully, the best thing. Okay. And if a patient starts exhibiting signs they feel faint, or the skin is going, the facial expression is something, they cannot breathe and dizziness something, or they may be showing the hand like this, which means immediately stop, pull the needle, look for them. What you can do, how to avoid all those situations. It happens. Okay, ask them how they are doing, monitor the patient, and if you feel nervous, like tell another person to come in. In the usually in the phlebotomy areas in the lab, there are so many people walking around. You can just wave your hand, someone will come. It's not like a closed room, but in clinics, we have closed rooms, closed labs. Okay. Be prepared for them to hold, so to avoid any concussion or falling to the ground or something like that. So if they get a head injury, then you will be blamed. Okay, be ready to stop the collection, see who is around to assist you, all those things. Usually what we do, if there's someone is telling that, we will already alert someone, can you come after 5 minutes to check if everything is okay? So this is what we do, we discuss before poking. Okay? Clear?
Clear, ma'am.
Why?
Yes.
Why? When I ask why, there's no answer. I'm wondering. You say
Why
yes
what?
because
The question.
what the question? Why you have to, okay, when we do the procedure, when someone is telling yes, in the previous one, we just fainted, I fainted. Of course, you're going to take it to the other room. You'll make them lying down on the bed. But before
Yes.
that, you just step out and ask another person. After 5 minutes, just pop in and see how it's going. Why?
To
If
have
we
a
need
witness as
help
well.
and to have witness.
If we need
You
help.
cannot leave the patient By
Please.
itself.
Yes.
Yes. So we need help, but to make sure, okay, let them come. Instead of you leaving the patient going outside, as a precaution, you step outside, tell someone, come and just have a look. After 5 minutes, that's fine. If the other person is a healthcare professional, if that person is with you, you have to accept that as with happily, because everyone is busy. In that situation, you need help in one way or other, especially in the beginning, because you're just trained and then you're starting the procedure, right? You may be anxious, so it's better, safe side. Clear?
Yes, miss.
There, ma'am.
Okay, so never turn your back on you. For example, you have drawn the procedure, the patient has said, okay, no, I'm fine. I have nothing to worry about. So now you have drawn the blood and then you're writing on the label, or just you're fixing the label on the tube and you're turning your back. Can you do that? Don't do that. Sometimes in the previous draws, the patient might not have experienced the fainting, but now this time, you don't know, due to some other reason, the patient may be going down and you're not aware of it. It's not a good sign. So always face the patient, even after phlebotomy. Okay? Yes, Santiago, go ahead.
Miss, I have a question about when the patient faints. So let's say they're in the chair and you didn't know that, they fainted during phlebotomy, right? Or they didn't have any previous complications or whatever. To pull out the needle, do I have to pull out the tube and then pull out the needle, or can I just take out the needle with the tube and then
In this situation, you don't have to wait for pulling the tube or pulling the needle. Just pull the whole set, and because
so the main concern is the patient at that moment, so just pull
patient,
the whole
yes,
needle
the
out and then-
needle injury
okay.
should be avoided.
Okay.
Needle injury should be avoided. It doesn't matter pulling the tube, not pulling the, you immediately release the tourniquet. Tourniquet has to be released because the blood flow will be there. Sometimes when the flow is like vigorous, you can see the blood will come like a fountain. Okay, so immediately release it and pull the whole unit. That's what I'm telling you. When the patient says that they are fainting, it's like an alarm. So you actually make others know that there is a fainting patient. Come after 5 minutes. That's a big relief. But if the patient is okay all the time, this time that patient is fainting, call someone loudly. Help!
Okay. All right.
Someone will come. But by that time, you have to be free of tourniquet, free of the needle. It should be fine. Because we
Okay.
also go in anxiety. I'm an anxious person, for example. I don't know what to do. My brain is blocking now. So that person who enters may take the alternate help. Clear?
Yep, clear.
Yes.
So if you know how to handle, general procedure is we have to tell the patient to put their, or you can make the patient put their head down on a pillow like this, and then you have to keep the ice pack here, cold compress in the neck. But for all these things, if you're an experienced person, you can do calmly. Otherwise, you will also panic. So better call an experienced person, get the help. But I will ask these questions when you come to SimLab, so be prepared to answer the questions when I ask. So keep an ice at the back of the neck. Ask the patient to put their head down if they feel faint. If they feel, you can tell them to put. If they are fainting, you can't control them. You can't tell them anything. So ask the other. So why the other person? The other person may lift it, help to put them on the bed, and then you can follow and you can wait for 15 minutes, 30 minutes. If still not in gaining the consciousness, call the 911. If it is a pregnant patient, call the 911. Don't take chances. We cannot take chances. Okay. If they do faint, the bar in front of the chair will help patient from sliding down. So why now you know why we have the front bar, side bar in our phlebotomy chairs. There's a reason for that, right? So that's the reason. Now you know why we have a pillow. That pillow is not good, but generally I'm telling you, when you go to the real phlebotomy, the pillows may be good. They must have a good pillow. Stop the blood collection immediately, remove the tourniquet, needle and engage safety device, call for assistance, let patient remain in area for 15 minutes and they should not drive for 30 minutes. All these things are for you as a guideline. Document the incident in case of future. Why we document, the reason is, if someone is making some other mistake when they go home and they think that you did something wrong, that's why they are in that situation, they will bring your name. They may sue you. So we don't want the unnecessary headache. Document, document. That's why we document. You have to write on this day, in this time, you did the phlebotomy. The patient was asked about the fainting or syncope. The patient said no syncope before, and this time he fainted. Time and the date, your initial, period. What if they are driving and on the way they just felt the dizziness, they caused an accident, and that patient might be thinking that previously nothing happened and this time you did something, that's why he fainted or caused the accident. Then they will call you. Hello, who is the technician? May I talk to them? Okay, this happened, this happened, this happened. What did you do? You did nothing. You did everything the same, but the patient condition was different. But if you document, if the patient was driving, in case if they end up in an accident, there is a proof that there is an episode of syncope. The patient should have taken precaution while driving. They should have called someone to take them home. It's not your fault. You're free from that. Clear?
Clear.
Yes, clear.
Clear. That's why we document it. So they will know, okay, when the patient came, nothing happened before in the previous things. There's an evidence, but this time it happened, but this is not your fault. You made them lie down. You documented it already. Now this patient who has taken the car for driving shouldn't have touched. Someone should have done the job. So you are safe. Clear?
Clear, ma'am.
Clear.
Okay, nausea and vomiting patient. What do you understand by this? Nausea and vomiting patient is like some of them when they, I don't know, psychological, could be psychological, definitely. Some of them when they see the blood, they will throw up, they will vomit, or they feel like nauseous. Okay, and sometimes their fingers will become pale, their face will become pale. Okay, and you can see they will be sweating. Discontinue. Don't take chances. If something happens, they'll blame you. That's the reason. So take it out, give the patient an MSS basin. So if they have, the MSS, what does the MSS means? And the MLPAV question. EMESIS. MSS means throwing up, vomiting.
Throwing up.
Yeah, it's a beautiful medical term, MSS.
Throwing up.
Throwing
The
up.
act
So
of vomiting.
vomiting. So vomiting is colloquial language, English language. Nausea is little bit twisted language, okay, but still it's in use. But MSS we don't use normally. But when you see the medical records, they won't write as vomiting or nausea. They will write as MSS. Clear?
Clear, ma'am.
Clear.
So if the patient says like feeling like throwing up, keep something ready, a small tub, something. Usually the clinics, they have that. Give it to them. Otherwise they vomit on you because they don't know what you cannot tell them go to the washroom, run, go and vomit because it's not under their control. Understand? So keep things ready. Make sure these things are ready before starting the venipuncture. The fridge is ready for the ice pack. The MSS basin is ready. So anything or garbage is ready to bring it closer. The best thing in case, but don't do the procedure. Stop it. And what you have to do?
Document.
Document it. Very good. Document it. Get them to breathe slowly, deeply. I think because of the anxiety, this anxiety is a very bad thing. It can lead to different types of what do you call, symptoms, and it's very hard. You cannot blame them. It could be their nature or mainly the genetics or the situations, the environment where they grow, and all these things matters. You cannot blame them. Help them. They are humans. Help them. If they do vomit, make them feel comfortable and then make sure they are fine, take rest. Some of them, they usually for this emesis, what I have observed, give them popsicles. Now, of course, in the lab you are working, you don't have to stack with the popsicles and everything. The best thing, the best remedy that I have seen to be given is popsicles. You know, the fruit juice, real fruit juice sticks helps a lot. Because whatever they eat, mainly with the migraine patients, whatever goes in comes out. Right? That's only outside coming, output, no input. For 2-3 days, I'm talking about, for them, the best way to get something inside is the real fruit juice popsicle stick. They have to chew a little bit every time. This is the energy for them. And Advil comes out, Tylenol comes out, nothing, there's no remedy for that.
Miss,
It's
don't they
yes.
also don't they also sell a Pedialyte popsicle? I'm pretty sure, as well.
Yeah,
That,
they
like,
have it. Yeah, they have it. But still, some people, majority of them, they felt that this ice fruit popsicle, it helps. Just water with the color with the fruit extract. That's it. With some nutrients going inside the body, because emesis is a thing that takes away all the nutrients, followed by dehydration. It's not a good sign. When the condition's more severe, they have to get an IV in the emergency. Otherwise, the patient may collapse due to dehydration. So another critical thing that you have to consider, right? And pain. What is pain associated with? Pain means normally, yes, there'll be a minimal pain, and tell them, okay, relax, give them the ice, give them the confidence, it's okay, you will overcome these things. And that's why we shouldn't lie. Tell the patient, I'm going to poke. Okay, so their brain will be prepared. Give them some time. If then they are anxious, give them some time. Some patients will tell, okay, give me some time. Then give them some time. Okay. If there is a lot of pain, it means you have touched the nerve. Nerve pinch is bad. People will jump out of the burning pain. Okay. And so remove the needle. If they say like, okay, the patient says, okay, it's not like a tolerable pain, immediately you have to take it out because you have touched the vein. It's not the vein, I mean, nerves. That's why it's not easily recommended in the basilic area, because the basilic area has a thin skin. I'm repeating this. I'll ask you again. The basilic area has thin skin with the more nerve endings. If you don't know exactly where you're poking, it'll be a big hematoma with the pain, severe pain. Be careful. And it can damage the nerve permanently. So petechiae, what does petechiae means? Petechiae is like, sometimes I have noticed this in some students and even real patients. The needle goes in. Okay, there'll be purple or brown or red color spots. Whenever you put the tourniquet, or after poking also, they will get this, because these are the capillary bleeds that come to the skin surface. It's okay. Keep them, monitor them, keep the ice. It will go away. What about the seizures or convulsions? I'm stopping here. We'll continue with, I can finish the seizures and convulsions. It can happen. This is a very critical condition. Okay, that's why we have to make a face contact while doing the venipuncture. Why? Because it doesn't mean this is caused by the venipuncture. It can be different reasons, but you have to immediately stop the procedure, hold the pressure, call for help. You have to shout for help. Okay, and put the patient to floor, because they may get hurt because of the movements. It's uncontrollable movement that they will make. And the first situation, your reaction will be panicky. You will panic first. Okay. And when you put them on the floor, turn them a little bit and hold it in that position, because the damage for the hands and legs will be minimized. If you leave them as such in a flat position, the way they throw their hands and legs can damage if there is a chair or any object. So turn them and give the support so the movement of the hands and legs can be minimized till you get help. But the first thing, you scream for help, look for help. Keep the airway clear, so nothing should be there. A mask is there, remove the mask, the airways should be clear. Okay, and put something under the head, the pillow you will be having put it, and if the clothing is very tight, just loosen the clothing. Okay, do not restrict the patient movement. It's very, very important because you cannot do anything. That comes from the brain signals. The movement is coming from the brain, so you cannot control them. And don't tell them stop it. They can't do anything. Just keep them safe without injury. Ask for help, because this is totally a different condition. It's not under the control of the patient or you. I'll stop here. How was the class? Too much information? Interesting? Because tomorrow we will be doing the review. So
Very
just tell me your
interesting.
opinion. Tell me
Very
your opinion.
interesting.
Sometimes when I ask you, I think you're physically present but distracted because you tell me to repeat the question. So how should I take it? Should I take it that I'm fast, or the way I speak is not clear, or you are daydreaming or distracted? Just a quick question from my side.
No, ma'am, everything was clear. It was good. Thank you.
So it means you are daydreaming. It's okay to
No.
daydream, huh? No?
No, sometimes we think
We're
sometimes
listening.
before we answer.
Yes.
Sometimes, okay.
Sometimes
Sometimes
we
you're
think first before we answer.
okay. So I can take it in a way that you are connecting the situation and you are still in that situation. It's hard to come back.
Mesa,
cannot-
sometimes I think it's the computer. Sometimes the sound goes in and out. And so that's why I would ask you to repeat, because I didn't hear it clearly.
Yeah,
Oh,
that's
okay.
like a
Yeah,
big,
that's true.
big
Okay.
thing. Yeah.
Okay, nice
Yeah,
having
there
you
is
here
a
as
feedback.
students. Yes, okay, thank you so much. Because I want to make sure that I go slowly. That's what I want to know. Actually, this topic is really, really interesting, right? It's really interesting. So I hope you enjoyed. So tomorrow we can do some revision. If you don't understand, go through the information so we can discuss about it. We can watch videos. Mostly tomorrow will be a discussion class or a revision class. So be here on time tomorrow, 9 o'clock. Nice to have you as students. You're amazing, all listening with good qualities. I appreciate it. Have a wonderful evening. Thank you so much.
Thank you, Miss. Take
Thank you,
care.
Miss.
Thank you.
See you tomorrow,
Repeat
guys.
and have a good afternoon, ma'am.
Thank you. Thank you so
Bye.
much. Bye.
Bye.
Thank you. Bye.
Bye.